Hello, everyone, and welcome back to Pre-Health Shadowing for another virtual shadowing session. My name is Nina, and I am the founder and CEO of Pre-Health Shadowing, and I'm excited to welcome you to another shadowing session with us today. We do have closed captions available for all students so that we can accommodate students of all abilities and needs. If you have any ideas about how we can increase our accessibility, feel free to email us at info@prehealthshadowing.com. Another fun tip is to save us as a contact to keep us out of your spam box. And so you can always join our sessions and never miss one. If you want to stay in the loop, we are on social media. You can find us on Instagram, TikTok, and Twitter at Pre-Health Shadowing. And you're even welcome to tag us. So if you have any videos that you're making, want to post on LinkedIn, you can tag us and you might even get reposted. So great opportunity to increase visibility and to share this with your networks. Pre-Health Shadowing is a student-based nonprofit organization that serves students from all over the world. I'm currently in California. Where is everybody else calling from? Feel free to throw it into the chat. Wonderful. We got students from all over today. If anyone is interested in being a part of this student-led nonprofit organization, you can apply on our website. Pre-Health Shadowing is 100% student-run and volunteer-based. We provide opportunities for students globally and to date have impacted over 65,000 students. If you want to be a part of this change and this movement, sign up on our website, www.prehealthshadowing.com/join our team to learn more about our leadership team and to learn more about the different opportunities that we have available. You can also register as a volunteer. This is a position where you can pick your schedule, choose your hours, and pick different projects to engage with. You can collaborate with members on our team, including myself, and earn letters of recommendation for future programs in schools. So you can apply and learn all about this online on our website. Go to prehealthshadowing.com and go to the tab that says Get Involved. You can find more information here about our volunteer team, our leadership team, and also our high school program. Pre-health shadowing does have a high school program as well, which allows pre-health shadowing to be established as a club on various high school campuses. If you're interested in being a part of this, you can go ahead and go to our website, prehealthshadowing.com, and find HTP. You can also look up HTP pre-health shadowing on Google and it should pop up for you. You can fill out an interest form to let us know a little bit more about your school, and we will connect with you and help you make that happen. Diversity is one of the core things that we're looking to promote in pre-health shadowing. We do have speakers from all different walks of life, background, fields in pre-health, and health professions. And so if you have anybody that you would like to nominate to be a speaker, you can go to our website, prehealthshadowing.com/nominate, and we will reach out to professionals that you would like to shadow directly. You can even get volunteering hours for this. Like I said, we are a student-based nonprofit organization providing free accessible opportunities to students. Obviously, it takes money to run a platform, and everybody in pre-health shadowing is currently a volunteer, including myself, and we do not get paid. We are working to keep this program free and accessible for students, and so if you are able to donate even just $1 for joining us today, you can go ahead and scan this QR code. We run completely off the time and money of our community. If you are financially unable to donate at this time, we do encourage you to share this with members of your community, family, or friends who you feel like would be able to support your education. Thank you all. Throughout today's session, you can type your questions in the chat. The end of this virtual shadowing session will be our Q&A, and we will go ahead and ask all of those questions to our professional so you can get your juicy questions answered. We also encourage you to take good notes because we do have a post-shadowing assessment that will occur after the end of this virtual shadowing session. If you're new here at pre-health shadowing, the post-shadowing assessment is a 10-question assessment that you get 2 tries in 30 minutes to pass. Upon passing the post-shadowing assessment, you're eligible to receive a certificate that verifies your virtual shadowing hours with us today. So take good notes and ask great questions. We are all in little boxes right now. We do encourage folks to turn on cameras if they are able to, and to keep themselves on mute unless they are asked to unmute themselves to ask a question. A little face-to-face goes a long way, especially when we are in this virtual remote environment. So if you are able to and in a safe space, you can go ahead and turn your camera on for today. Without further ado, I would like to welcome you, our professional today, Sandra Fineman. Thank you so much for joining us.
Thank you. Thank you for having me.
Whenever you're ready, you can go ahead and share your screen and we can get started for today. Students, we will be having some interactive elements, so we will be asking you to pull up some links on your end and we'll be sharing those in the chat.
Great, thank you. Can you see my screen okay?
Yep.
Great. So thank you, Nina. Thank you for having me. And thank you for putting together such a great program for your students. I really wish I would have had this when I was in your guys' stage of the game. So I appreciate you guys having this for your colleagues and your future colleagues. So thank you again and for inviting me to be a part of it. And so hopefully you'll have some questions, and if you have anything that you want to get more out of, please feel free to reach out at any time. So I'm just going to start with what kind of my little presentation is going to look like. I'm just going to give you a little bit of background of who I am, give you a background of my education and my clinical practice. So kind of give you what it looked like in the day of me practicing clinically. And then I did transition into academia. So I will talk a little bit about who I am now and what I'm doing. And IPE, which is interprofessional education, which is a really big part of what I do now. And so what that means, how that's processed through the education and also in clinical practice. And I'll end up with some tips and takeaways and just end with our Q&A. So just to get started, a little bit background of who I am. I was born and raised in Southern California. So I see a lot of Southern California people on the chat, and everywhere from Southern California to New York and everywhere in between. So welcome everybody. I am a first generation college student, so I have a different perspective on how I got to becoming a PA and medicine in general, because I didn't have a lot of the support systems that you generally have when your parents or anybody in your family or close network has been into college. And if there's any first generation students out there, you might be able to relate to this a bit. I know as a first generation student, I didn't realize that I was at any necessarily disadvantage as I was going through school until now, as I actually have children who are in college, and the way I'm able to guide them through their college process and just giving them the opportunities to explore things that I never had. And because both my husband and I are college educated, I think my kids have such an advantage to that. And so I don't ever want anybody to feel guilty about having that advantage. I tell my kids, like, don't feel guilty about it. And anybody here who might have parents who are in the healthcare field, especially, that is great. Don't feel guilty about it. Enjoy that. But also realize that that's not everybody's world. So not everybody has the opportunity to do that. So you can't just expect like, oh, well, why didn't you ever go to a hospital when you were growing up? Didn't your mom or dad work at a clinic? Sometimes that's not reality. So just making sure that as you understand, are a lot of first generations, and I want to support any students who are first generation students, letting you know that there are places to reach out to, and anybody who does have those advantages to kind of connect with people in your family or who have been through it. Just making those connections is really important. Both of my parents were born in Mexico, so I am first generation Mexican American. I do speak Spanish, and there is a bit of a story I'll let you know about that, how that led me to medicine in general. I am the youngest of 3. Both of my parents were, blue collar workers. My dad was a carpenter. My mom was a cafeteria manager. called the lunch lady, at the elementary school. So kind of grew up in some humble beginnings, but just really had a good opportunity to be encouraged to move forward. So this is just giving a little background of who I am, and anybody who's in the situation, like, you can do what you want to do. So don't limit your dreams depending on where you come from. Each and every one of you has a dream, and you guys can achieve it. So I just encourage you to do that. Just giving you a little bit of background on my education. So after high school, I went on to study at Cal State Fullerton, local California State University down the street. I always loved science. I was a math and science nerd in high school. I loved to study math and science. One of my advisors once told me I should go into engineering because there weren't many females who liked math and science at that time, and engineering was a growing field for especially the underrepresented females who were excelling in math and science. I had no idea what engineering was. It's funny that my son now is studying engineering, and I laugh because I tell him I thought engineering was like the people on a train, the engineer of a train. So I never realized what that was. And that was kind of, again, my limitations because I was a first gen and college was just not in a lot of our pictures. But I was fortunate to go to college because I did want to pursue more studies in science. And this actually started when I was about in seventh grade or so. I was in the hospital because I had acute appendicitis. So appendicitis is infection of the appendix, and it's a surgical necessity. So when I had acute appendicitis, I ended up in the hospital and ended up having to have surgery because I was about 13 when it happened. And at that time, we didn't have laparoscopic surgery. So laparoscopic surgery nowadays limits the time that you are actually in the hospital because the incisions are very small and your healing process is very quick. Dating myself, back when I had appendicitis, laparoscopic surgery was not an option. So I had an incision which required overnight stays at the hospital. So I stayed a few nights at the hospital. And I tell you this story because this is what really led me to my passion to go into medicine. And one of the days that I was in the hospital, I had heard a baby that was crying relentlessly. And if you've heard a crying baby, you could tell when they're just not comfortable. And it was really sad. I love children. I always was the babysitter when I was growing up. And as I was doing my morning walks, after surgery, they encourage you to walk, I found the room where the crying baby was. And I saw the mom and I said, "Hey, is your baby okay? I heard the baby crying." And the mom just said, "Hablas español? Do you speak Spanish?" And I was like, "Oh, I do." And she says, "Oh," and tears in her eyes saying, "Can you help me? Can you translate for me? My baby is hungry. My baby needs food. And I can't tell the nurse. The nurse, can you help me communicate this to the nurse?" And so I said, "Sure." And I had the nurse come in, and I translated for the mom and just let her know, like, the mom's saying that the baby's still hungry and that's why the baby's crying. And at that time, the nurse was like, "Well, tell the mom to feed the baby if the baby's crying." And so I was like, "Mom, the nurse says to feed the baby." And so basically a discussion occurred about the mom thought that the nurse was feeding the baby, and the nurse thought that the mom was feeding the baby. And all of this had to do because of a language barrier. The mom did not have the language skills in English to be able to express her concern to the nurse. The nurse didn't speak Spanish. And so it was really impactful for me. Then later that morning, when my mom came to visit me at the hospital as I was recovering, I told her the story. And I remember her saying, like, we really need bilingual providers in medicine. And you have such a love for science. You should really consider going into medicine. And that was the first time that I really thought, like, wow, being in the medical field is actually something that I have something to offer. And so I went into Cal State Fullerton. I actually went in as a biology major. I thought I was going in as pre-med. And again, because I didn't know the system, there really wasn't a pre-med major at Cal State Fullerton. So it was a biology major. And as a biology major, I was loving my science classes. I thought everything was great. I actually met a young physician at the time who gave me the advice of saying, you're doing all your biology classes. I wish I would have studied something beyond biology. I graduated from medical school. All I know is biology. I'm a science guy. That's all I know. Like, what do you love? What else do you like? You're going to get your biology prerequisites. Is there anything else that you would want to know more about? And like I said, I've always loved children. I always thought I wanted to go into pediatrics. And I thought, well, if I study about normal child development, that would really help me understand the abnormal developments and diseases when it comes to working in medicine. So I switched my major to child development and I loved it. Knowing now, I probably should have had the major or minor in biology because I had enough of the prerequisites in biology. But again, not knowing the system and not realizing that I could have officially had a minor in biology, I was just happy to get a bachelor's degree. And with that bachelor's degree, I actually went on to, during college, I was using a lot of my child development skills that I was acquiring to babysit and kind of make some money to get through college. And that was another turning point for me because as I was babysitting, I met a physician. She was a pediatrician and I was babysitting her kids. And I thought, what a great opportunity for me to kind of pick her brain. Again, I didn't have these type of opportunities that you guys have here, but I was like picking her brain of like, I want to be a pediatrician. I'm studying this and I'm learning about this and tell me about it. So I think this is one thing that I really encourage all of you to do is if you can talk to somebody in the field that you think you want to go into, it's really helpful. When I was talking to this pediatrician, I actually realized I don't think I want to be a physician. And the main thing happened was I asked her, like, what's your day like? What do you do? And she had told me that when she was had her first child, she was in residency. And when she was in residency, she had very long hours, very long days, lots of studies. And so she really missed the first couple of years of her child's growing up. She felt very sad about that and said, I couldn't do both. I had to just really focus on my studies, long hours at residency. So really my parents raised my son for the first 2 years. And so later, after she graduated, she got pregnant with her second child. And at that time, she says, I don't want that to happen again. So she didn't work at all. She was home with her second child 100% because she didn't want to miss those early milestones she had missed with the first child. To me, that was a big, oh no, that seems like an all or nothing kind of career to me. I felt like you either had to be 100% in or you had to be 100% out. And that's not my personality. I really like a balance. I like to have a good family life, but I love to have my career. So it really hit me like a ton of bricks, like, uh-oh, maybe this physician career is not right for me. And so I went back to school and kept my studies. And at the time, I had co-created a club called Professionals for Diversity Awareness. The diversity has always been something really big in my life as well. And our faculty advisor and I were really close. So I talked to my faculty advisor and I was like, hey, I just realized I'm going this pre-med path. I really thought I wanted to be a physician. And I just realized, I don't know if this is right for me. This might not be the right career for me. And I don't know what to do with that information. Maybe I should be a teacher instead. Maybe I should go into education. And she said, it's interesting that she had the similar experience as I did. She was thinking about medicine as well. And then for other reasons, decided to go into education. And she said, I kind of regret it. I regret not studying medicine because I really love science and I love medicine. And although I like my life as a professor, I wish I had some science background, like going into medicine. And it's really hard for me now to go back to medicine. But if I would have gone into medicine to start with, I could always have an easier transition to go into education. And so she really encouraged me to not give up on medicine. And what she told me that really resonated with me was there is more to medicine beyond a physician and a nurse. And so I think I knew that, but it was just hearing it was a really big awakening. Like, oh my gosh, you're right. Like in my head, I was always have to be a physician. And then other than that, there's a nurse. And so I really started to deep dive into what other fields in medicine are there that I can go fulfill my love for science, my love for caring for people, but at the same time, have a more of a balanced life that I was looking for. And that's when I came across the PA world. So as a PA, as a physician assistant, when I found out what that career was, I found out what they do. I really started to go into a deep dive there, and just it spoke to me. And I thought, this is exactly what I'm looking for. It fulfills my need to practice medicine, but also gives me the flexibility to do a little bit more on my terms of where I wanted to work, the hours I wanted to work. I remember the pediatrician asking her, what is the hardest part of your job? And if you guys haven't asked anybody this, I think this is a really good question to just have it in your back pocket. Anytime you're talking about anybody who you think you might be in that want to go into that career that they're in, ask them, what's the hardest part of your job? Asking them what the best part of your job, that's always fun to hear. But I think any one of you can do the best part of my job, right? Everybody, like I can do the best part of anybody's job. It's whether or not you can do the hardest part or what the hardest day of somebody's job. If somebody tells you this is the hardest part of my job, and you sit there and you go, wow, okay, that's hard, but I could see myself doing that, then I feel like that's going to really get you into the right direction of where you want to study, what career path you want to take on. So when I asked the pediatrician, like, what is the hardest part of your job? And she said to me, being on call as a pediatrician and having to leave my son's first birthday to go take care of another child, or having to miss their holidays with my family because I had to get up on call and be somewhere else. And I'm grateful for people who can do that. In my heart, I felt like, I don't know if I can do that. I grew up with a very close-knit family. I always knew I wanted to have a family, have children. And I just thought, wow, like putting myself in those shoes. If I'm sitting here with my child on Christmas morning and I get a call that says, hey, you need to come into the hospital right now, could I do that? And I wasn't sure I could. And so that was one of the reasons too, that I thought maybe being a pediatrician or a physician wasn't for me. When I looked at being a PA, I found that there's so many other areas of medicine you can go into, and you can choose kind of your schedule a little bit more because you're always working on a team with a physician as well. So that gave me more flexibility. If I was working with a physician that didn't require for me to be on call because they were on call, then great, I didn't have to do that. So that was when I really decided I'm going to pursue the PA career. Now, I was ready to graduate. I had a bachelor's degree, but I did not have any clinical experience. So you don't need clinical experience to go into medical school, which was my path until this point. So once I graduated with my bachelor's degree, I actually got a job at a surgical center in Newport Beach, so not too far. And that surgical center, I started my first job as literally scrubbing the floors of the surgical suites and washing the instruments. And when I interviewed for the job, I remember the physician telling me, you're overqualified. You have a bachelor's degree. What are you doing here? And I just said, if I wash the instruments, I'll learn what they are. If I'm in the surgery room, whether it's cleaning or scrubbing or what, I will be in medicine. And that's going to be my first stepping stone to get into medicine. And so he's like, okay. And I told him what my ultimate career goals were to get more patient care experience and go into PA school. So I worked with them for 2 years. And during those 2 years, they trained me to do vital signs, draw blood, work with patients in post-op care. I did circulating in the OR. I even at the end was scrubbing with the physician, with the surgeon. And so I really got a lot of patient care experience. I also got in the network of medicine. So although surgical centers, it was a great starting place, I knew I wanted more medicine and more kind of patient care when they're awake and not so much when they're asleep or right after surgery. So then I moved on and during that time, I got an EMT certificate. So I went back to school and I got my EMT license. And here's my next job was working as an ER tech in the emergency room at a local hospital. And so that gave me the experience I needed to then apply for PA school. So I applied for PA school. I went to Stanford Primary Care Associate Program. This was back probably before some of you were born, back in the late 90s. Back then, it was called the Primary Care Associate Program. Now it's the Physician Assistant Program. And it was a certificate program. So the history of PA is we started the profession as a certificate program. And it has evolved into becoming a master's program. So the terminal degree for a PA now is a master's degree. It is trending towards becoming a doctorate degree. So if you're interested in the PA profession, I would say just keep an eye on how that trend is moving. And there's multiple reasons for that. I think the main reason is a lot of the health professions are doing it, and it does put you at the table with all the doctorate level. Is there a question? So it does put you at the level, at the doctorate level with all other health professions. So it seems to be that's the trend. So just again, to keep an eye on.
Hey, y'all, just a quick reminder, keep yourself on mute, please. Thanks.
And so I already had a bachelor's degree going into PA school. Now that's required. Back then it wasn't. But I ended up going back to school and getting my master's degree as well. So I got my master's degree in PA studies at the University of Nebraska. And I also, at that point, was starting into teaching. So I got a certificate in health professions, teaching, and technology. So I think I'll take a pause right now and can we do the poll so I can just see where everybody, so that's a bit about me. So I want to hear about you. So I know we have people, almost 70 people here. So just kind of want to know, where are you in your studies? Where are you in your health profession journey? And so I think we have a poll that we can set up, Nina.
Yep. If everybody can quickly go into the chat here, we're going to have a quick poll. I'll share my screen. This is what it's going to look like. Very simple here. It's going to ask you what stage you are in your pre-health journey, and you can go ahead and answer that, and I will go ahead and show you all what the results are. So go ahead and take a moment. It'll open it up in a new tab for you all, and the link is in the chat. Cool. I'll go ahead and share the results here. Well, we got 11 submissions. Go ahead and continue submitting those. For those who answered college undergraduate, go ahead and throw in the chat, what year of undergrad are you currently in?
Perfect. Thank you. Thank you for answering that. Just gives me an idea of where you're at, so I know where I'm speaking to. So I see a lot of undergrad and some post-grad. Okay, patient care experience. Okay, so I'm hoping some of my story kind of resonates with maybe some areas that you're in right now. So if you're an undergrad, two takeaways that I got that I wish I would have known is you can definitely look at the biology prerequisites that you need to get into whatever health field you're going into. So whether that is PA or MD or speech pathology or DPT, whatever that might be, make sure that you're getting those prerequisites. But also keep your mind open to having another major. Like you can do, like I said, I did child development, and I felt like that really gave me a different perspective. It was completely different than my science, my anatomy, my physiology, my microbiology. It was more of a psychology, sociology. So it kind of gave me some different views on how I was really moving forward in my career. So for undergrad, definitely having that open mind. And then for those of you that are getting your patient care experience, it doesn't have to be your optimal patient care experience when you start. You can always create it. So obviously I didn't think I was going to get a lot of patient care experience as I'm cleaning the floors of a surgical center. But truly by the end, they taught me how to do sutures. I was doing scrubbing and circulating and all kinds of, because they saw that my interest was there. So you don't always have to look for that dream patient care experience to start with. You can develop it. So that's kind of my two little keys there. So from there, I'm going to just talk a little bit about my clinical practice as a PA. So as a PA, once I graduated from PA school, I went on to get to practice into family medicine. So family medicine was a lot of what I wanted to do because in my program was a primary care program. So we really focused on taking care of patients through the spectrum of life from, cradle to casket, we would call it. So having that foundation in my schooling, I really wanted to apply it. So I went into family medicine. I went into an underserved local community, a big Spanish-speaking community. So I remembered why I wanted to go into medicine and really the community I wanted to serve. So I really looked for that job when I graduated, and I really had the wonderful opportunity to work into family medicine. My day in family medicine was so interesting and exciting. We would start our mornings between 8:45 and 9 in the morning, and we would go till about 6 o'clock in the evening. And every single patient who walked in was very, very different. So the great thing about family medicine is you're never bored. Some people think family medicine, oh, it's like physicals and well exams, and it can get redundant. You definitely have those days, but I literally had days where at the time we would see pregnant women. So we had days where there's somebody at the front door ready to deliver a baby. And then we had days where I had a 95-year-old at the table having a heart attack and really getting to the end of life. And we had everything in between. So some patients would walk in and you would be dealing with a cardiovascular issue. So something with the heart or lungs. And then the next patient, it could be a orthopedic issue. So it could have been a sprained ankle, a broken bone. It was everything. It was great. It was busy. Because we were in a Spanish-speaking community, I was really fortunate that I got to use my Spanish-speaking skills. And then because it was a blue-collar community that we were servicing as well, we would open every other Saturday because a lot of our patients were working all day and would get home from work late or had different hours during the week that they would work. So Saturdays was another option that we had for our patients. So it was wonderful for our patients. It was a wonderful first career for me, but it was hard and exhausting. I did that for about 5 years and learned so much and do not regret a thing about it. But when my husband and I were married and we were starting to think of starting a family, and I went back to is there balance here? I would get off work at 6 o'clock, sometimes a little bit later, and then I'd be exhausted. I'd drive home. It was about 45-minute drive home. So I was getting home sometimes 7, 8 o'clock at night. And then I was going in every other Saturday. And I thought this is going to be really hard to maintain as if I decide to start a family. So the other thing that I found in family medicine, my favorite part was taking care of women and children. I worked with a male physician, and it worked out really well because all of our male patients, a lot of them from a Hispanic background, which I'm very familiar with, felt uncomfortable having a young at the time, a young female taking care of them, especially when it became sensitive male needs. So they would gravitate towards seeing the male physician. And then the children, because I had this child development background, I knew how to connect with them. Parents and children, the mothers especially, would come to me. And so we had this natural divide where I would see a lot of the women and children, and he would see a lot of the men. And that just is what we both love to do. It wasn't necessarily any premeditated plan for that, but it just turned out where patients were like, I want to see you again. And patients, a male would say, I want to see him again. And so it just worked out that way. So when I was starting to decide I wanted to transition into careers because I wanted to start a family, the one thing that physician assistant is a very nice added benefit, I guess, because we are trained as generalists, there's the opportunity for lateral mobility. So what that means is when I was practicing family medicine, I transitioned into pediatrics. Generally, when you go into becoming a physician, you generally will do a residency in one area. And if you wanted to transition, you can go back and do residency in something else. So it's a lot more time, a lot harder to make those lateral transitions. PA gives you that flexibility to do that. So when I decided that I wanted to switch after 5 years of practicing family medicine, like I said, my heart was really with children. And a pediatrician actually had reached out to me and said, "Hey, I know, I heard that medicine's a small community. I heard you're leaving family medicine. You're looking for a new place. You want to come over to pediatrics?" And I said, "Well, I do want to start a family." So I was very transparent with her. And I said, the reason I'm leaving is because I don't want to work very late nights. I don't want to do Saturdays. And she was like, "Great, that's exactly what I'm looking for. Here's what I have to offer. What do you think if we do this? And when you get pregnant, if you get pregnant and you want to start a family and we have to adjust the schedule, we can do that." And so it was wonderful. Her and I worked together for another almost, 6 years. And we were just so very close. Our patients thought we were related because we practiced so similarly together. Our patients were really wanting to just connect with both of us. So it was a really nice practice. At that point, I had 2 kids. They were in preschool. And as they were starting to get more time into school, I really wanted to bring on more hours to my clinical practice. And so I added women's health because that was the part I felt like I was missing out of my family medicine passion. So then I went into practice for women's health. So both of my days in pediatrics and women's health looked very similar. We started off about 9 o'clock in the morning. We ended pretty reasonably about 4 to 5 in the afternoon. We saw more narrow scope of medicine. So it was really nice to go from family medicine, where I'm seeing everything from cardiovascular problems, orthopedic problems, pulmonary and women's health and pediatrics all in one day, to now I'm going to transition. I'm just going to focus on pediatric issues. And so everybody who walked in my door during pediatrics, I knew they were going to be under the age of 18. And there's certain diseases that are more common in that age group than in other age groups. And then it was the same thing with women's health. Now, at this point, all I had to do is let's focus on issues that happen in women, right? So we did do pregnancy, but we did OB as well. So it was a nice transition for me when I was trying to slow down my pace of clinical practice because I was taking care of 2 young children at home. And I just wanted to be able to focus my clinical practice that was a little bit more attainable, where I wasn't, having to work till very late at night and also having a lot of, I guess it's a lot to have your mind go from one area of medicine to the next area of medicine within the next 15 minutes. So that worked out really well for me. Now, I did that for about 10 years. I worked in clinical practice. And I'll tell you this, transitioning into academia is my next step. So as I transitioned into academia, one of the main reasons I did that was because living in Southern California, in Orange County specifically, there was not a PA school at the time. And I had actually come to the school I'm at right now that with my son who needed vision care. The school that I'm at Marshall B. Ketchum University is started off as an optometry school. So the Southern California College of Optometry. And it's a small nonprofit school across the street from Cal State Fullerton. And I brought my son here for vision care. And in researching the school for his vision care, I found that they were developing a PA school. And honestly, I was mad. I was like, what the heck is this optometry school doing, developing a PA school? I had been working in the community for 10 years and had really gained the trust of my patients, because PA was not as common back then as it is now. You had to gain the trust where patients like, what is a PA? What do you do? I don't know if I trust you. It took years and years for me to be with my patients, and they really trust me. And I thought, now this school is opening up in Orange County, first school in Orange County, and you must be doing it for the money. And as I felt very protective of my profession. My profession was very young. It was very vulnerable. And I felt like I wanted high quality education to continue. And I was concerned that an optometry school wouldn't be able to provide that. As my son was getting his vision care, he would come in for vision therapy, which is kind of like physical therapy for the eyes. I would walk around the school and figure out who's in charge of this PA school. What are you guys doing? What are your intentions? Why are you trying to ruin my profession? And what I came to find is they're not trying to ruin my profession. They actually know what they're doing. I met the developing program director, and I met with the president. Everybody had very good intentions. They heard me. They understood my concerns. I actually volunteered to do interviews for our inaugural class, which is the class that here graduated. And so I started out as volunteering. I had no intentions of leaving clinical practice. But then as I got to know the school and I started to remember, like, I do love the teaching aspect of what I do in medicine. When you're in medicine, you're teaching your patients. I teach moms and dads on how to care for the pediatric patient every day. I teach women how to care for their pregnancy every day. I love that about my job. So maybe going into academia makes sense for me. And so I started to explore that option. And I was working part-time in clinical and part-time in academia, so at the university. And over the years, I started off as principal faculty, and then I started getting more hours. I got busier with the university and ended up having less and less clinical time. So I went to assistant director of the PA clinical education, which is basically the second year of our students, once they have done a full year of didactic education, where they're learning all about the clinical medicine, the pharmacology, the anatomy, the physiology, all of that. And then they go into clinical rotations to apply what they learned. I always called it the fun year because it's really why you go into medicine. And from assistant director, I went on to being a director of the clinical education. So I've been with this university since the inception of the PA program. And I can honestly say that the level of education that PAs get is everywhere, but especially at this university has been superior than anything I've seen. And I take joy and privilege in being part of that, raising the next generation of PAs. And I think one of the important parts is we know that we are training people to take care of our lives, our families' lives. They're taking in a very important role. And so we take that very personally. I also fulfilled my need of, because I always, like I said, I had this need and this want to, diversity has always been important to me since undergrad with our Professionals for Diversity Awareness Club, and then going into my Spanish speaking community, being in the university, I thought, what am I going to do to fulfill that need? So I helped create a medical Spanish course as well. So to this day, I continue to teach. It's been 10 years now that we've been teaching a medical Spanish course, and I co-direct it with a optometry professor as well. And so that leads us to where I'm at today. So today, as I'm an associate vice president for the Center of Interprofessional Studies, and so what that is with IPE. And what IPE means is basically when you have two or more professions working together. And what we're seeing now is patients are coming with very complicated diseases. It is okay and normal to not have the answers to every single thing. One person can't do it all. And we need to know how to work on a team. So for example, we have our students practice with a simulated patient who might have complicated diabetes. When you have diabetes, it affects a lot of organs in your body. Everything from your heart, your kidneys, your feet, your eyes. And we're not experts in everything. No one can be an expert in everything. So we know that talking to an optometrist, getting an optometrist consultation to come in to help our patients and to evaluate the eyes, to see if they have any diabetic retinopathy, to see what they can do to help the patient when it's related to the eyes. We also know that there is new developing medications every single day. There's multiple medications patients are on because along with diabetes, they might have hypertension. They probably have high cholesterol. They have multiple. And although PAs are trained in prescribing medication and knowing what to reactions to look for and contraindications. We don't spend 4 years on that, but pharmacy students do, and pharmacists do. So we collaborate with our pharmacy students as well and have them on the team. So basically what we're doing is we're trying to see what does the patient need and who is the best person to be on our team to take care of that patient. So part of IPE is, and what we do now is really giving our students a chance to practice what working on a team of healthcare professionals looks like. How do they share their role? How do they know? How do they communicate what they know how to do and ask for input on others depending on their own scope and their own area of specialty? So that is IPE. And then IPE in clinical practice is our next step too, where students will go out into rotations and be able to work on a team with pharmacy, with optometry. It might be social work or speech therapy. It might just be whatever the patient needs. They go out into clinical practice to achieve that. So that is IPE. That is the Center of Interprofessional Studies. And I'm going to just close up my last few minutes here with some tips and takeaways. So my tips to you is explore your options. When you're thinking, I really love science, I love medicine, I want to go into medicine, just think beyond the typical physician and nurse. I mean, those are great professions. I love anybody who goes into that. But also, if those don't speak to you, there's other professions that you can look into in medicine. Maybe it's pharmacist, maybe it's optometrist, doctor of physical therapy. There's all kinds of different things that can help fulfill your yearning to practice medicine and taking care of patients that's beyond or different than our traditional doctor or nurse, okay? Be intentional. When you're exploring your own opportunities, like you know yourself best and you want to be intentional about what you want out of medicine, out of life, out of just, you want to be able to bring your best self to your profession. And so if you're going to try to be somebody, like if I would have gone the pediatric route, I am sure I would have made myself do it, right? I don't give up. That's kind of my personality. But I probably wouldn't be so happy. I know myself now well enough that that path would have not led me to where the path that I am now, that brings me the joy, brings me so much more, I feel so much more reward with it, because you just have to be intentional about what you choose and making sure that that's what you want. Don't do it for the status. Don't do it for the money. Medicine's hard, and the money will, like, it's never going to give you the reason to do it. Don't do it for the title. If you just want to be a doctor, that's not a reason to go into medicine. So just remembering those things and just being intentional about them. Keep track of your activities. This activity is one of them, especially. Like, you guys are doing a lot and you have opportunities to do a lot of this shadowing, even just volunteering, helping with health clinics, whatever you do. When it comes time to apply, so a lot of you are in undergrad right now, and you're going to apply to this, your next step of whether it's medical school or PA school, whatever it might be, you're going to have a hard time remembering everything you did. So I always recommend to a lot of the undergrad students that I advise is keep a Word doc on your home screen of your laptop. And every time you do something, just put it in there, like pre-health shadowing, this date, and then a few sentences of what you got out of it, maybe some contacts. And so if you keep a running document of all of your activities, when it comes time to apply, you have one source where everything you did. That leads me into the next one, which is use your passion to create your own recipe. So what I mean by that is, don't try to do something. If I got into PA school, I could tell you how I did it. You doing exactly what I did isn't necessarily going to lead to your success, because I did things for a certain way and a certain calling. You need to go back to that, be intentional, explore your options, kind of find your path and build your own recipe to your own success. I always think of it just, like in baking, I could create something from scratch and it could be wonderful. And I can give you the recipe and you might follow it, but might not come out the same way. We've all done that, right? But if you have different ingredients and you're like, I like this, I like that, I'm going to put this all together and I'm going to create this masterpiece. It is you, and it's going to be much better than if you just followed somebody else's recipe that had, butternut squash that you don't like or something like that, right? So you make your own, and that is where you want to do that's where your passions come into play. Lastly, remember your why. Your why should be your North Star. For me, like I said, having that experience when I was young about a patient needing care and not having the language to be able to express that really resonated with me. I felt like I knew I needed to provide care for patients that needed my Spanish speaking skills. And so having that as always being my North Star, wherever I ended up, I always wanted to make sure that I continued to fulfill that passion, and fulfilling that, guiding me to that North Star, like having that why in my back pocket. It helps me get through some hard days, because you're going to have hard days. School's not easy. I don't need to tell you that. Medicine's not easy. If you have, why am I doing this? Oh, this is why I'm doing this. It gets you through those hard days a lot easier than if you forget that why or you don't have a strong why. So I'll just leave you with, remember your why, have it be your North Star, and we can close up with questions. And just wanted to make sure I wish everybody a wonderful journey. Enjoy the process. It's not always about the destination. The process should be just as rewarding. So Nina, do you know if there's any, I wasn't following the chat. I don't know if you wanted to.
Yep, lots of great questions from our students. Students, I do invite you, if you do have any other questions, go ahead and put those in the chat. I'll be going ahead and asking each of your questions as we go through our shadowing session here today. Awesome. So we'll go ahead and get started. The first question that we have, if one was to switch between different areas like family medicine to pediatrics, would one still be able to work in either of the fields?
The short answer is yes. The long answer is it really depends on the state that you work in. So for PA, we have state laws and regulations that we have to apply for our state license. Now, we are certified nationally, so there are some national overlaps, but every state has their own regulations on how you can practice. So for example, in the state of California, before 2019 or 2018, don't quote me on that, we used to only be able to practice in the area of medicine that the physician that we worked with were practicing. So in my example, I'm working in women's health. And in women's health, I know how to put in an IUD, okay? But if I decided to also work in a urgent care and a patient comes in and wants an IUD, but the physician I'm working with at the urgent care does not know how to put in an IUD, I couldn't put in an IUD. That's the way it used to be. I want to say it's 2019, we passed Senate Bill 697, which is a Senate bill that basically said, I'm allowed to use my own scope of practice to do what I am trained and competent to do. So if I am trained and competent to put in an IUD in women's health, there's no reason why I can't do it when I'm doing urgent care on the next day. So for me to transition, so to answer your question, to transitioning from pediatrics into family medicine, you can still practice in the state of California. It used to be I could only practice pediatrics if I was working with a pediatrician, but now I can practice pediatrics even if the physician I'm working with is not board certified in pediatrics, because this new Senate bill acknowledged that I have been trained and it didn't matter where I was working with. I always still have to be a part of a team with the physician, but I have my own set of skills that I've been trained and I'm competent in that I can take with me wherever I go. that answer your question?
Amazing. Thank you so much. We had another question in regards to the work-life balance that we were discussing earlier. Um, Kim asks, do you feel like the it's gotten better for folks going to pursue an MD or another medical degree, trying to balance work and family? As you spoke
That's
about your pediatrician mentor.
Yeah, that's a great question. I definitely think that we are all more aware of the importance of all of our mental health and the importance of balance. I think the challenge is when you have people, there's still that if I suffered, you're going to suffer, right? Like you still have some of those older people in positions that are maybe their experience in residency or as an early physician was I needed to do 80 hours a week. And so I'm not going to let you off easy. You're going to have to do 80 hours a week too. That is less and less, thank goodness, because we are trying to get everybody to understand we are all people and we all need, having a lot of care and mental and physical health and, jobs are jobs, but people are people and that should come first. So I do think there is a movement in that direction. But burnout is still very high for physicians. Burnout is real. And there's still a lot of people in positions that aren't seeing the value of taking care of each other, unfortunately.
Definitely. Shameless self-promo here. We do have pre shadowing, which you can do on your own time from anywhere. Our next question is, while attending Stanford, how did the program incorporate serving underserved or diverse populations into the curriculum or into clinical rotations?
So when I was at Stanford, it's developed a lot since then. It has, I can't speak to it as much anymore now, but I know it's a wonderful program and it's definitely developed. At the time I was there wasn't a lot of push to incorporate that. They did, though, encourage us to go back to our communities where we grew up. And so a lot of us did come from communities that were underserved or needed the diversity. So they did encourage that. I can tell you more from like our personal university here at Marshall B. Ketchum. We do have students are required to do at least 2 rotations in underserved communities because we feel like we want to make sure that they understand medicine can be practiced differently in different areas. So if we have you just do your rotations, for example, at Kaiser, you're going to learn to be a Kaiser PA or at Providence. But if you learn to practice medicine with patients who have PPO and patients who have no health insurance or who have limited or underinsured, then you'll have a different appreciation for how to practice medicine. So I think it behooves us to teach our students all the different things. So we do require that. We also require students to have community service time. So we have multiple projects throughout their didactic phase that they are required to pick 1 or 2 of the ones that speak most to them. So we don't make them do anything specific. We give them a list and here's like this community service. We're doing a health fair. They might want to be interested in that. Or maybe we've had some students go to El Salvador and do some medical clinics with our faculty there. We've had some house building down in Puerto Nuevo in Baja California. So there's different things that we do offer. So I could speak more towards kind of what Ketchum does now than what Stanford did, because that was 25 years ago when I was there.
Thank you. Our next question is, what are some false assumptions that people make about PAs?
Oh, that's a good one. I like to call them myth busters. I like to myth bust them because so PA in general, our title, I got to be honest, is a pretty bad title. The fact that it's physician assistant, a patient's perspective, and you all can think about when you hear the terms assistant, you expect that the non-assistant is going to come in and do treatment as well. And so I think it's one of the reasons that there is a movement to title change of PAs is because our patients are getting confused by our titles and by what we really do. So if you see an assistant, you might not think that an assistant can write a prescription or can diagnose you or can be your main healthcare provider, which we can. So one of the biggest misconceptions is when you see the title physician assistant, that we are literally next to a physician and handing them and assisting them physically. Now, the title made sense when our career started back in the 70s. We did start as a career that physicians needed help. And so they trained medics that were coming back from the war to get a medical training. They were already doing this stuff when they were out on the field. And now we just needed to fill the gap between what you were doing and the anatomy, the physiology, and everything behind it. So it made sense. Our original term was actually physicians, apostrophe s, possessive assistant. So the physicians possessed us, possession. And then it got changed to drop the S because it's just physician assistant. And now it's still being nationally, it's physician associate. So our American Academy of PAs is national title is physician associate. And the reasoning for that is because it is more representative of what we actually do versus the term physician assistant, which doesn't really represent what we do because we do practice. We have our own license. We do practice, have independence that we practice. We collaborate with physicians. We don't necessarily assist them.
Our next question is, was the switch to teaching easy? Did you have to get additional schooling?
Oh, that's a great question too. I have done a lot of additional training, and I was very hesitant to come into academia because I knew I wasn't trained as a teacher. And when I was hired, though, my 15 years of clinical experience was what they wanted me to share. What was your clinical experience with students, not necessarily writing the syllabi, right? So it was when you go into clinical, you go from clinical practice into teaching. At first, I was having a bit of imposter syndrome, like, why am I teaching? I never learned to teach. And I had mentors who were very much encouraging of, first of all, you teach your patients every day. Like, go back to that, you know that teaching. And second of all, you have clinical practice experience. So I started teaching, my first course that I taught was the physical exam. So I taught students how to do a complete physical exam. I would teach them to do like special tests on when they're doing the hearts, the lungs, all of that. So that was what I did in clinical practice every day for 15 years. It was a very easy transition. Now, as I've gotten more into administration and more with strategic planning and things like that, I have done a lot more training in the medical area, in the education area, so academia. I've done badges and certificates and had other things like that. But the transition to going from being a practicing PA to coming into teaching, I taught women's health. I practiced women's health for 5 years. That made sense for me to teach. So that was a very easy transition.
This is a follow-up question, kind of on a similar topic. What part of your educational journey that was built into the school curriculum did you feel like really impacted your professional career in academia?
Oh, that's good. I think the biggest part that in PA school that impacted how I moved to academia is our health maintenance teaching. So a lot of what we do is preventative care for patients and health maintenance. So we were trained to talk about how to get patients to be compliant with their medications or have their annual exams or their vaccines. And so you're trained into how to teach somebody to take care of themselves, medically speaking. And so a lot of that training transitioned very easily into training students, if that makes sense. And a lot of times, like even for many times, it's like talking to patients and talking to students, it's very similar, except my students are healthier. But you do get a lot of that overlap of the way you're communicating and the way you're teaching to students, a lot of overlap of how you communicate and teach to patients.
Thank you so much. Our next question is from Carla. What advice would you give to first generation students navigating PA school for the first time?
Believe in yourself, Carla. I don't doubt yourself because even those students on this call who are not first generations are going to have the same doubts. But because you're first generation, I think you're going to focus, or one tends to focus more on that. So believe in yourself, don't limit yourself, and ask for help. There's people out there who want to help. It's okay to not know your next steps, and it's okay to ask for help, and just believe that you can do it because other people will believe in you as well.
Beautiful. Our next question focuses on the high school route. What are some things that high schoolers can do today to prepare themselves to get along on the PA path?
That's great. I think there's so many great things high schoolers can do. I've had a few high schoolers reach out to me, and I've known some are even taking like EMT classes during the summer, farm tech classes, to work as farm techs in the pharmacy area. Things to get patient care experience. And even if it's not directly to PA, like get into the medical field to see if that's really what you like. A lot of times we have the vision of, oh yeah, I like medicine. And then you start to see what it is. You're like, oh wait, maybe not so much. So I would say start asking people who are in the medical field, ask to see if you can do some shadowing, keep doing these type of webinars that, Nina's offering here. If you want to get into a job, take some CPR classes. You can do lifeguarding. You can go, at the beach or the pool. Anything that gets you into kind of clinical reasoning is really helpful for you to take that first step into medicine.
Wonderful. Thank you. Our next question is from Jenna. How do you feel that your experience working as an ER tech benefited you and prepared you for PA school or even working as a PA?
Oh yeah, that was one of the best experiences I've had to get me ready for PA school. Just being with the physicians and the nurses. At the time, the ER I worked at didn't have PAs. Now they do. But when you're in the ER, and I would always try to think of what their next step's going to be. So as an ER tech, a patient came in with chest pain. I already knew they're going to order an EKG. They're going to order, these blood tests, the troponin. They're going to have. I would try to think in my head, what's the physician going to ask me for, and I'd be ready for it. The physicians loved it because I would be there with an EKG machine ready for them to say, order EKG. And I'm like, yeah, it's right here. But it helped me clinically because at that time, I wasn't the one making the decisions, right? So if I had the EKG machine there and it happened to be an 18-year-old who got hit with the baseball and they don't need an EKG because it's not his heart, it's actually the ribs that was fractured. It's no skin off my teeth. It was like, we don't need the EKG. But I was able to start, what would my next step be? And when it wasn't the EKG, I would, at an appropriate time, go back and ask the ER doc, like, hey, that, 30-year-old came in chest pain and you didn't order an EKG. Like, why did you not order it on this patient, but you did on that patient? And so that's the experience that I would get in the ER, asking questions, seeing what other people are doing, like really learning from others' experiences. Even if I'm not the one making the decisions, I was learning on why they were making the decisions.
Thank you. That's huge. I feel like that is something where we can really put ourselves in positions as students who may not have that authority to not only teach ourselves, but also to benefit. Things can go faster.
Absolutely.
Our next question is from Ben. Ben asks, besides the clinical hours, what are some other things that can help set an application apart when applying to PA school? What does your university value the most in an applicant?
We value community service. And when I say community service, I think it's intentional community service. So don't just do things because it's going to look good on your application. I'm on the admissions committee, and I've had students where they did community service, and I would ask them about them in interviews, like, why did you do this, certain community service? And they're like, yeah, well, it seemed like a good thing to do. It was kind of my fraternity or my sorority offered it. And okay, cool. Glad you did it. Versus I had a calling to do, I'm an athlete and I love being in kind of that athletic world, and the Special Olympics needed somebody, and I was able to help, people with special needs do the Olympics. And it's just like try to connect that passion to what you're going to do. So don't just do it to check box a mark. Like, yes, community service is important. And sometimes you think you're going to like it, and it's really didn't call, and that's okay. Like, you might have to try a few things out, but once you really know what you like, just go all in and be committed to that community service. Like, do it often, keep going back, show that you have commitment to it, and you're not just doing it to check a box saying, I did community service. Like, have some passion for the community service that you're doing.
Beautiful. Thank you so much. Just another reminder, pre-health shadowing does have a 100% remote leadership and volunteer team that you can start your own projects and support students and work with their mission to fight inequity in health education and promote diversity in the various healthcare fields. We went ahead and put some links in the chat if you're interested in learning more. But we'll go ahead and jump to our next question. Jenna asks, do you have any advice or starting points for beginning to write a personal statement for CAPSA? CASPA.
Yeah, CASPA, yeah, yeah. Yes. Okay, so tell your story how you want it to be heard. Don't tell it how you think I want to hear it. So a lot of times you're writing a story and you're starting off with, the ambulance noises and we're not looking for a novelist. We're looking for your true intentions of why you want to go into medicine. So oftentimes I think people get stuck on let me write a story that is, like, you would be a great writer. If I was, admitting you into an English course or a poetry course, this would be fantastic. But like, why are you telling me this? So connect when your story. So if you have a story of why you want to go into medicine, or if you have a story that you want to tell us about when you overcame, a difficult situation, like, why are you telling me this? Are you telling me this because you learned some skills to help you overcome difficult situations? Are you telling me the story about your relative having a medical issue because you had some type of awakening of medicine, or it caused you to really go into more research of medicine? Like, what is the purpose of the story? Not just telling a very nice, well-written story. Like, try to connect the you inside and your passions to the story you're telling.
Amazing. Thank you. Our next question is from Paris. Paris asks, is getting a PA education a good way to get general experience of most medicine paths? I want to be a surgeon, but I also want to experience other professions in case I don't like being in surgery.
I think once a PA isn't really a stepping stone. I think you really don't want to use it. You're going to put a lot of money and a lot of hard work, dedication. It should be your terminal profession. If you want to go into surgery but you want to get exposed to other fields, I think there's better ways of doing that. And you could even do like a nursing, an LVN. A lot of LVNs tend to use that as a transition into a different area of nursing. You can be a scribe. A scribe will follow a provider, whether a PA or a physician or any provider around, and take notes for them. And so if you want to get an idea of what an ER is, you can work as a scribe and you're following them. You can have a scribe in family medicine. You can have scribes in specialty areas, rheumatology. There's certain clinics that have scribes. I think that would be a better way for you to be exposed to other areas of medicine without the financial and time and the commitment it takes. I would view PA more as a terminal profession than a stepping stone into either physician or surgeon.
Thank you so much. Our next question is from Jenna. Jenna asks, do you feel that extracurricular activities, shadowing, leadership, and research experience are helpful in making a competitive applicant, or do schools primarily base admission on GPA and patient care hours?
It depends on the school. I could tell you our school, we do value those things. We look at you, it's a very holistic view. We want to see the person, and we definitely, I mean, even having sometimes we'll see people who are in like D1 athletes, and it's like, wow, like we know what it takes to be a D1 athlete. Like we know, and that, yes, it has nothing to do necessarily with medicine and science in your GPA, but it does show grit and it shows commitment and it shows dedication. Or having people who do the community service, that does weigh a lot for our school. I can't speak to a lot of schools, but you definitely have to have the grades. We don't want to just get somebody to come in who we don't think is going to succeed. You have to have the grades, but those things that you mentioned do make you stand out at our school because we look at the whole picture. We look at the holistic view of a student. Like, are you in community service? Have you done research? Are you, co-curriculars or extracurricular activities? Are you an athlete? Those things do come into play.
Thank you so much. Our next question is, what is the best way to go about acquiring in-person shadowing hours if you do not have connections in the healthcare world?
Hmm. I think the best way is asking and asking and asking. You don't know who has the connections. So you might be in a circle that, so for example, like my kids' circles, um, their friends, one of their friends just talked about, oh, like I'm thinking about maybe going to medicine. And it's like, oh, you should talk to my mom. She's in, so they knew he's not in medicine, they know that, but they don't know who he knows. And so your circle might not have that medicine connection, but don't stop talking, don't stop asking, because it's 3 degrees of separation. You can have that clinical shadowing that you're looking for. And most of the time when people are in medicine, we want to help other people get into medicine because we know it's a needed profession. We know we need people to take care of us, and somebody trained us, so we want to train you. So that is the general theory of most people in medicine is I want to train you because somebody took the time to train me. So I would say just even if you don't think that they're the connections you need, don't hesitate to ask because you don't know who they know. I mean, we've had people that just in our, conversations will come up and say, oh, I'm looking for this. And it's like, okay. And then I'll get a call from 3 different people, like my cousin's friend's sister's brother, right? Was looking at this. I'm like, oh, great. Send him my way. Yeah.
Amazing. For all the students as well, virtual shadowing is a great stepping stone into in-person shadowing. Pre-health shadowing is built with the intention of providing an opportunity for students who don't have connections into the field of healthcare to connect with professionals like Sandra Fineman here today and to get to hear from them, to connect with them, to get contact information. And through virtual shadowing, you can reach out to us at Pre-Health Shadowing. And I went ahead and put this information in the chat, but I also want to vocalize it for any of our asynchronous students as well. If you have a professional that you virtually shadowed with Pre-Health Shadowing and you are in the same geographic area and you are interested in connecting with them in person, go ahead and shoot us an email with information about yourself, your school, your interest, your location, as well as the shadowing session when you attended it. And we can forward that to the professional. And if they have capacity, they can reach out to you and invite you for in-person opportunities. So while we don't generally, pre-health shadowing is not an in-person shadowing organization, we are happy to facilitate that connection for those students. So keep asking, feel free to ask us, ask professionals. A lot of times our professionals will share a link after for the in-person folks, so that'll encourage students to join us for our live sessions when possible. Sometimes our professionals will throw their email into the chat, and that gives access to our in-person shadowers to connect with the professional. We'll go ahead and move on here with our next question. Our next question is, how do you deal with burnout?
Oh, that's great. I think I personally, the one of the best things that I did early on in my career is having variety. like I said, I like balance. I needed variety. When I was doing family medicine, variety in my patients really kept me from getting burnt out because it wasn't the same thing every day. I had long hours. And so a couple years into that, I remember asking the physician I work with, like, hey, I need one afternoon off a week. Like I feel myself starting to get burned out. I'm just here. And so I took Wednesday afternoons off. And it was like you gave me a 4-day weekend. Like having Wednesday afternoons, all of a sudden, I had time to go to the grocery store when nobody else was there. I had time to just sit and do nothing. It was 4 hours a week that made such a difference. I think it allowed me to work years beyond. So those 4 hours, and with the physician I worked with, I mean, my salary was the same, so I didn't get cut back on salary. He knew it was worth him paying me those 4 hours, and keeping me longer with him than it would have been for him to cut back the few $100s I probably would have made in those 4 hours, and giving me that balance. So variety is really important. Knowing that your profession is important. I love my profession. It's important, but I also love my family and love my activities and my friends. And like, this is not just who I am. Knowing I have other interests and hobbies and things beyond my professional life has kept me really in balance. And I think the last thing, and I share this with my own kids, is don't expect to have balance every day. Like there are some days that I might work 10 or 12 hours, but if I look in the span of a week or in a span of 10 days, did I find time for myself? Did I find time for my family? Did I find time for my profession? Am I in a span of a week, am I finding balance? But I can't say in a 24-hour period, I'm going to have 8 hours to myself, 8 hours to my family, 8 hours to work. Like that's not always possible. But I can look at in a week and say, okay, I think it's time for me to do something for myself because I really worked long hours on, Monday through Friday, and now I need to take a break, or just having that perspective of looking at your life in more than just a little 24-hour period. You got to look at a bigger, because there are going to be days that are going to be hard, and you are going to have to do a lot. And knowing the other thing I like to do is always have something looking forward to. Like we're big vacation people, so it's like I know in January I have a vacation coming up. So right now it's going to be, if I have a fall semester where I'm doing a lot of teaching and it's really hard, I know come winter I'm going to have something on the calendar that I'm looking forward to. I know summers I might have something scheduled because I know I get really busy during the spring at work. So I need to have something on the books in summer to just help myself know, like, okay, I'm working hard now, but there's a reward over there.
Definitely. Thank you so much for sharing that with us. My final question for you is, what is the most impactful case that you've been on? And can you walk us through that?
Yes. I think, gosh, there's so many, and there's so many in different areas of impact. A couple of them that come to mind is the most impactful case that has really worked, like when a patient has a bad outcome, when you have to give a patient bad news. In women's health, I think the hardest thing is how many times that I had to do an ultrasound looking for a heartbeat of the fetus and it's not there. And having to deliver that news and being done in a academic, a very, like, what does this mean? There's no heartbeat, but also being a human of being there for the patient. That is probably one of the hardest things that you have to do. And it's similar. I've had with pediatric patients. I mean, nobody wants to see a terminal disease in a child. Having to give that news to a parent that this child has been diagnosed with a very difficult disease, I have to say is probably one of the most impactful. So there's the good stuff too, right? But like I said earlier, I could tell you the good stuff and you're all gonna be like, oh, I could do that. Like telling somebody, yeah, yes, you're pregnant, congratulations, or being at a delivery and it's all wonderful and joyous, or having those wonderful, like, oh, you came in with this problem and we get treated it and now you're all better. All of those you can deal with, but the ones that really stay with you are the hard ones and the difficult days. And I think those would be the two that stand out the most to me.
Wow. That is difficult. And I feel like there's so much discussion about like the humanity in medicine and healthcare. And I feel like that brings up a huge topic of discussion that unfortunately we don't have time to go into right now, but I think is definitely a conversation that we should continue as students and as professionals as we continue to grow in this field.
Absolutely. Yes.
Wonderful. Well, thank you so much, Sandra Fineman, for joining us today. I'm going to go ahead and for all of our students joining us for today, I do have information on your next steps. So as students in pre-health shadowing, you do have the opportunity to take a post-shadowing assessment and get a certificate. If you're interested in learning more, stick through this wrap-up presentation, and I'm going to go through step by step not only ways that you can get that certificate, but ways that you can leverage that certificate as well. So I'm going to go ahead and share my screen here. And before we get into how we get our certificate, we really want to take this moment. This is the nearest moment that we have post shadowing session to reflect what brought us into the session today. What are the major takeaways that we got from this presentation, and what do you still want to learn more about? Taking this snapshot of how you are feeling and what is going on right now is increasingly important as you get closer to applying for various programs. We really want to see what students are learning. And so I encourage you to take time, whether it be in your journal or in a Google document or on your notes right now, to take some time to reflect on why you came to shadowing, what you got out of shadowing, and where this is going to inspire you and what your next steps are going to be. We encourage you to share your insights on LinkedIn. For those that don't know, LinkedIn is a professional social media platform where you can share and expand your social network of professionals. So displaying your involvement in programs like pre-health shadowing and tagging pre-health shadowing will help expand your professional network. Pre-health shadowing has over 200 professionals with shadowing sessions, many of those who still follow up with pre-health shadowing. And so this is a great opportunity. Many of those are associated with institutions and universities. And so being able to share your involvement can not only use yourself to leverage, your network that you're in, you are now part of the pre-health shadowing family, but also to find future opportunities. Once again, if you're interested in being a part of pre-health shadowing, this is a great way for busy people to get involved in a meaningful leadership and volunteering activity, as we talked about in our shadowing session today. You can apply on our website, www.prehealthshadowing.com. Volunteers, you can do synchronously or asynchronously and work on various teams like grant writing, research, volunteer coordination, even hosting live sessions like what I'm doing right now. If you're interested in any of those and more, visit our website and explore a little bit more about what we have to offer. You can also apply to be a leadership team member and commit a larger amount of time and have more responsibility, like managing a team and overseeing various outlets like our website, social media, writing and editing blog posts, and more. Once again, this is a 100% volunteer-based, student-led nonprofit organization working to create and promote flexible and accessible opportunities for pre-health students looking to enter the field of healthcare. We're open to students everywhere for a cost of $0.00. And because of that, we are humbly asking you to scan this QR code and either donate, share, or do both. And this will help us continue our efforts to keep this program alive. Now the moment you guys have all been waiting for. How do we get our certificate? What you'll do is you'll go to the website www.prehealthshadowing.com and you'll click on Sandra Fineman's profile that we have on the website. This is going to take you to the quiz, and you'll continue there to take the 10-question multiple choice post-shadowing assessment. You will have 2 tries and 30 minutes to pass with a 70% or higher. Upon doing so, you will have access to finish the course and download your certificate. We encourage you to save this somewhere great, whether this is a Google Doc or printing it out if you would like. If you save it as a PDF, you can then use it and upload it to various outlets if needed. If you missed any part of the session today, don't worry, this is going to go up on the website and our YouTube channel. You can follow our YouTube channel, like, comment, and subscribe at Prehealth Shadowing to see any of our previous sessions for free. If you do want to get the post-shadowing assessment certificate, you do have to go through the website, so I'd encourage you to do that. And we have a ton of sessions coming up. Some of you might be approaching finals right now. Some of you might be already done with finals. We have a 5-day in a row session marathon. It started yesterday. We have another session tomorrow, one on Monday, and another on Tuesday. We are still booking live sessions, and we will have a ton more live sessions coming up. So be sure to catch our sessions every week. Follow us on social media, and don't forget to keep checking the website for new and upcoming sessions. That's all for today. Thank you all for joining me. Again, my name was Nina, and I'm the founder and CEO of Prehealth Shadowing. I will stick around at the end of this meeting if anybody has any questions. And thank you again to Sandra Fineman for joining us today. Bye, everyone.